Welcome to the Demonstrating Implementation Excellence stream of the SNOMED CT Expo 2022. My name is Ian Green. I'm still the Customer Relations Lead for Europe and Global Clinical Engagement Lead, and I'll be moderating today's session. All questions will be answered at the conclusion of the presentation. Online attendees, please use the Q&A box to type in your questions to the presenter. And on-site attendees, please can you use the microphone provided. So I'm now pleased to introduce an old colleague of mine, Jay Kola from Termlex, who will be presenting, is it possible and is it useful to create a common ontology model for multiple systems of traditional medicine using SNOMED CT? So Jay, please proceed.
Thanks, Ian. So let's make sure technology works. So hopefully people there can actually hear me. Let me start sharing my screen and let's see how that plays out, right? So, okay. Please, can somebody tell me if you are able to see my presentation mode?
You're visible and audible.
Perfect, perfect. All right. And so, hey, I'm Jay Kola, and I've got a colleague of mine, Sarah Harry, who's in the room there. Again, it's an interesting topic, and I like how Ian described it. Is it possible and useful? And we realize that this is actually what we would call an atypical or a niche area. But this is something that actually we think is absolutely fascinating to look at. So we're here to say, could we actually try to standardize traditional medicine using SNOMED and also explore why this might be good to do and what benefits you might have? So without going on too much, I guess, hang on. Technology, there we go. So as I said, we are a team of what I would call terminology geeks. So we've done various things in the space. Won't go too much into all the details, but some of what you're about to hear is a distillation of our experience having worked for multiple NRCs in different countries also, actually. So let's really start with why we are here and understanding, or at least by defining what traditional medicine is. Okay, so again, because we are terminology folks, we have probably multiple words for the same thing. So in this case, what we are calling traditional medicine is defined by what WHO says it is. And actually, that's a long definition, and I've tried to actually underline what I think is more important to remember. And remember, this is theories, beliefs, experience, but the definition is also about the maintenance of health, right? So, and the reason I'm pointing this out is there's lots of words people use for it: alternative medicine, complementary medicine. So I'm saying this is one single bucket, and that's traditional medicine. Now, if you look at what WHO then says about what is health, well, they define it as not merely the absence of disease or infirmity. So they actually include a whole lot more. So clearly the scope of this is well beyond what we normally would look at as traditional medicine, as Western medicine, right? So before we go any further, we want to know how big this is so we can scope things down as to what this work is really about. So let's have a look. I think most people in the audience would have heard of traditional Chinese medicine. I'm assuming some of you might have heard of traditional Indian medicine, right? And of course, depending on where you're from, different countries, different cultures start this. So we can add Korean, we can add, other places as well. But what we found was interesting was when we started to look in the space, and that is just a selection of what Wikipedia lists as the different forms of traditional medicine that are actually around. As I said, a selection. So clearly this is a really, really big space, right? And I know I'm saying this with a smile, okay? There might be people who say, hey, something works for me, so it's clearly traditional medicine. So clearly for the scope of this discussion and the project, we are removing things like numerology, astrology, feng shui from the conversation, right? So let's be very clear. We are really defining those as out of scope. So what is actually the scope? So there's these notions, common notions of energies, deficiencies, that we'll cover later on. Those are the things that we want to actually keep in the scope of this work. So having stated that, let's kind of go on and say, right, why bother doing this? Who cares? So I always say, who cares? Plus, why is this important? So in this case, I think there's growing recognition that a lot of people choose to go for what we would call alternative forms of treatment, and that's essentially traditional medicine. And in some ways, I guess we get into a point in the world where we are recognizing that some of these are actually tied to your cultural identities. So that's also part of actually being what I would probably call more inclusive or being culturally sensitive. And of course, if you then can say there are parts of the world, and if you can see and learn from what happened in COVID, there were what you would call alternative or other ancillary or auxiliary healthcare people who were also involved in the COVID responses. And this has happened globally also. So we'll kind of stick to that because we can then get a lot of politics going on into this. But I think really recognizing that traditional medicine actually is out there, people are using it. So us not looking at it doesn't mean that it doesn't matter. Okay. Second, we were, really looking at it saying, hey, why would I actually care about this? So I kind of was thinking, going back a long time when I used to be a doctor, and I remember having these conversations where I might have treated a patient, they might have gone away, disappeared for a week when they should have come back, and they would have come back and said, hey, I actually went and I took some herbal medicine, some traditional medicine, and I feel better or worse. The point is, what do I do at this moment, right? So that's a practical problem that you do. And in some ways, this is almost a case of, we know in the world that we are in, or at least in the cohort that we are in, we always say electronic health records and SNOMED is great, so let's record everything. So our question was, well, hang on. If somebody's taken something that we think is active in some sense, and that is a substance, why wouldn't I record this information? And why would you want to actually even record it? Well, because clearly you want to know if this was an intervention that made them better, worse. So you want to record the impact on their outcome, right? And why would this actually matter? Well, because did they actually feel better or worse because of the placebo effect? Or is there something that's an active ingredient, could be a future anti-cancer drug, right? That was actually in that medicine. We don't know. And I think if you don't know, then what are you going to do about it? Now, the other, I know I'm playing devil's advocate here, right? So I'm saying, well, hang on, it's not good to say, oh, Western medicine is not holistic. Well, hang on, we've always been taught that Western medicine and people training Western medicine always say, you've got to take into account the patient's belief because you want to treat the person as a whole. So clearly, you can't have traditional medicine saying we're holistic and Western medicine is not. So I guess saying, let's actually address this. So I go back to what you would call Galileo, I guess, and his famous quotation saying, measure what can be measured and measure what cannot make measurable, what cannot be. So I'm applying that rule to what happens in traditional medicine, right? So how do I know an intervention is actually effective or not? The only way we can know this is if we start to record these encounters. And in order to record these encounters or treatments in traditional medicine, we got to have a systematized way of recording them. And only when we record it in a systematized way can we actually do comparisons. So that's really what we're after. And to get to the point of saying, okay, something happened, it's recorded, now let's look at outcomes. So then we finally come to this. If we agree that it's actually important to record, then why bother instrument CT, right? Because at this moment, anyway, in the context of the conference, this is about SNOMED CT. So why would we want to do this in SNOMED, right? So I think we all are here because we believe that SNOMED provides an excellent conceptual framework for organizing information around healthcare. So if you're doing this and you're anyway doing this with what you would call modern or Western medicine, and you've got electronic health records, it would actually just make sense for traditional records to be in the same space. So using SNOMED makes this easier, which is great, right? And I don't know if this is a trend or it's actually just the nature of how people are recognizing SNOMED's importance, but the countries that seem to have traditional medicine as a focus are actually also increasingly adopting SNOMED if they haven't adopted it already. So, hey, it's already there. It makes sense to do this, right? The way SNOMED is published, the way it's systematized, it also then using SNOMED to actually distribute or to represent this knowledge would also make it easier for application vendors to include traditional medicine content in a structured way into their product. All right. And of course, I think I've already mentioned being able to actually record it in the same way that you would record other information in SNOMED CT just makes comparisons analysis easier. All those are immediate benefits, but we also think because what sits behind SNOMED CT is an actual ontological framework or a conceptual framework. Being able to take something like traditional medicine, of which, remember, there's multiple disciplines. If you start actually with creating that framework, you could actually probably adapt this for other traditional medicines or complementary forms of therapy. So the why is, and why bother doing it in SNOMED CT? Hopefully that explains why we're trying to even look at this. Now, I have to actually declare, and I think I should have declared this beforehand, I'm the crazy idiot or the latter who came up with this notion and saying, oh, hang on, it should be possible to do this. And Sarah Harry, who's my colleague in the room, is who you would call the smart rocket scientist who actually went and did a lot of the homework. So if you find any flaws in this, please blame me. Sarah's incredibly knowledgeable. So if you don't understand what I'm saying, so stop me and say, hey, not too sure I follow this, right? Okay. So if we agree, it's useful to record traditional medicine and it's in electronic health records, and we think that actually doing this using the SNOMED CT conceptual framework is useful, then the question is, okay, where do we start and what do we do? So where we started when you look at the space was very simple. We said, let's do a horizon scan of what actually is happening out there, okay? And clearly, the first place we would go is to look at what SNOMED CT, so I'm SNOMED International doing and what is already in SNOMED CT. And I don't know how many in the audience are aware, but there's actually traditional Chinese medicine content that's already in SNOMED CT. Of course, it's not published in the way you would publish, you would expect it to be in the international edition, but it's published on the community edition. I don't know, sorry. I should probably call it community content is probably the right word for it. So you can go have a browse of it. Well, what we did when we looked at it, we investigated it. Of course, we reached out to SNOMED International. And we looked at the broad notions that they introduced. Again, here's a summary of it. I'm deliberately keeping the details light. Here's a summary of what they had to create. So they introduced a notion of a theoretical entity to represent a whole lot of things in traditional medicine. They also identified this abstract, again, they call it theoretical notion of a pattern. And this is very different to what you would normally think of patterns. And they also introduced an important notion of an organ system pattern. Remember, okay, this is very important because this is not the sort of anatomical organs that you're thinking, but this is almost a theoretical concept that is something analogous, but not the same as that organ, right? So these are some of the notions that they already introduced. And what did they do with it? Well, what did they do with it is, and remember, this is all probably work in development, so I'll get told off for drawing too many conclusions from it. But what they did is they used these base classes, if you want to refer to them as classes, to start to model what is actually stated or recorded in Chinese traditional medicine. So here's some examples of how this plays out. I won't go into details, but on the left, you start with what are the patterns, and you start to then say, okay, what would this look like in an organ system? You can see in the middle, you start to expand out, saying, hey, I've now got some system patterns in different organs, and then under each, in this final example, to your right, you can see that the kidney pattern is now something that actually comes under the kidney system. Okay. Also note that all of these are fully different concepts, but again, as I said, this is not about getting into the details of it, but to say, great, the work that SNOMED International has done, could we learn from it? And what else exists out there? So remember, different forms of traditional systems of traditional medicine. So we then said, great, okay, looks like Chinese traditional medicine is covered. So what can we do in the Indian traditional medicine space? So we then went and looked and said, okay, horizon scan, what are the base concepts here, right? So here's a few things that I will introduce you again to only to facilitate conversation, not to go into details, but in this case, they've got these notions of what we would call elements. Okay, so obviously we all probably know some of the elements, so earth, water, air, fire, okay. So that's broadly where you go with it. And hopefully most people are also familiar with the notion of humors. So they've got this notion of what they call air, mucus, bile. I won't use the exact words, even if I said it, hopefully it might not make sense, but they're called vata, kapha, pitta, right? And they have a notion of energy. So most of the traditional systems of medicine we see also deal with this thing called energy. In this case, they have notions of concentration or modes of energy, right? There's a lot of detail here, and deliberately I said it goes better there because you could go into the level of detail and probably never go past this particular slide. Important to note that they take these concepts and then they say a disease is broadly the imbalance of these things being acted on internally or externally. Okay, so when we looked at it, said, great, okay, so what did actually, what did the Indian NRC do in this space? So we then looked at what is published as the Ayush extension, which is almost meta for the three broad systems of Indian traditional medicine. That was published by the Indian NRC, a fantastic piece of work. They've got lots of content there. So those are the three systems of medicine within the traditional Indian medicine. So they've added thousands. No, I'm sorry, added is probably the right word. The content they published covers those three systems of medicine. So you can see there's thousands of actual content that is there, right? And broadly, just for the purpose of discussion, it does cover what you'd expect. So clinical findings, disorders, body structures, and on your left, on your right is a animated graphic of actually what is in there. Okay. Now, what is important to note is that they have actually gone ahead and said, cool, for every system or subsystem, if you want to call it that, they've got different languages. Again, there's a very good rationale as to why they did it, but remember that this is available in 3 different languages in addition to English. So what would this actually look like? So we went and said, cool, let's have a look as to what is in there. And we opened up, we browsed it, and so obviously these are screenshots from some of our tooling because we found that currently available tooling or the publicly available ones wouldn't actually cope with these level of complexity. So again, showing a tiny example of what is in there. So I've searched for anemia. You can see, as I said, there's multiple languages. So in this case, I chose Tamil, which is the language, and that's why those the renderings appear in this form. That you can actually see that there's a concept hierarchy that is modeled. What is important to remember is that it is partially in English and partially in Tamil because they haven't actually translated every concept in SNOMED CT, which kind of makes sense. So when we then really went to the details of what is in the Ayush extension, certainly, yes, they had new content, but most of what was visible when we saw was to do with the translation of content into those different languages for use within those reference frameworks, as opposed to what we were looking for, which are the theoretical / abstract notions, the humors, the energies that we were discussing. So we didn't find any of those. Now, if we missed it, clearly happy to be shot and told, Jay, you missed it. Right. So again, because I can't see anybody in the room, if somebody wants to say this, then please jump out and tell me. Right. So what did we then do? We said, okay, cool. So we got Chinese traditional medicine. We looked at Indian traditional medicine, but what do we also do about the other systems of medicine? Remember, this is about a common framework for all traditional systems of medicine. So we then went into look at the Arabic medicine. Well, let's just summarize and say that this seems to be a culmination of different cultural or traditional systems of medicine. And you can see the overlap that goes, and essentially the geography also repeats there. So there's Persian, Chinese, and Ayurvedic things mixed in there, right? So we said, cool. Again, we're not claiming to be experts on any form of these medicines. We are literally looking at what our showing what our research reveals. So when we looked at Korean medicine, it seems to have some cross-pollination from traditional Chinese medicine. Okay. Again, some notions that we found there, we thought, okay, they might not exactly be the same, but seems like there are some generic notions, right? So we're not saying they're all the same. We're saying that there's some common conceptual notions between them. Now that we've done this horizon scan, seeing what people were doing, we said, if we now want to represent all this knowledge, how do we actually do this? So we went about the way, traditional technologies would do it. We said, let's identify the shared notions and the concepts, right? To then start to aggregate them as different types and concepts. When we started to do this, again, keeping the detail deliberately light. So there are lots of examples or notions of energies that were seen in different systems. They all seem to share this. There were lots of notions of properties of systems. So there's imbalances, excesses, deficiencies. We found common themes of channels of energy. So in the Indian system, it's called the chakras, but in the other systems, they're also called meridians, lines. So think of them as places where conceptual energies are located. And this relates to whether part of the treatment is releasing of the etiology actually is blockage or excessive activation. And this then ties into other things like how do you treat it? So if there's blockage, what do you do with it? And broadly also, they also seem to have this notion of an organ system, which essentially isn't, as I said, the organ system that you and I would normally associate it. So a kidney is not the kidney that they're referring to, but it's more tied to the functional aspect of what that organ system does. Right? So the final 3 dots, so to say, there's a lot more things to be said here. Here is the expert in this space. I've deliberately cut down all the detail because otherwise, again, this talk is probably going to go too far and too long. So having done this, we said, great, let's actually then say, we got the top level, so we got the top level concept. So what do we actually now do to create a hierarchy? So we looked at what SNOMED International did. So on your right, again, it's probably work in progress, but that's kind of what the hierarchy for Chinese traditional medicine looks like in the community content. So we looked at it and said, well, hang on, actually that does make sense. Yeah, so you got a theoretical entity right at the top, and you then got body constituent theoretical entity, you've got an organ system theoretical entity, except we asked ourselves, right, hang on, does this actually cover all the things we need? And we found that it was not. So we broadly said, okay, so again, giving you some ideas as to what we think needs to be done here. So you want to start to organize this hierarchy, but to add the top level concepts that we defined previously or identified previously. So this is what we think it would probably look like if you try to remove some of the Chinese traditional medicine notions and actually made it a bit more abstract. So you start to see that it's got humors, it's got organ systems, which is from international work. It's got the notion of energy, it's got the notion of channels, and some imbalanced concepts. So what would this look like? So if I then said, okay, the concept of humor would then can be expanded. Remember the 3 examples I gave out? So that's what that hierarchy would start to look like. Yeah. The idea is not to flesh out all this in this talk, but to say this is how this could all work. So if you get the concepts right, and if you get the hierarchy right, what would the actual concepts look like if we applied SNOMED principles now? Let's take bile, humor constituent as an example. I am not playing a terminologist deliberately, so please don't point out editorial errors in there. No, please do, but hey, I'm saying that's not the point. So what we're trying to show is to say, how would the FSN look like? Well, it will be a theoretical entity, clearly. And of course, there will be a preferred term, which is obviously applying the SNOMED rules. This would look like bile humor constituent. Deliberately, I've just put it in the language in brackets. And you can obviously add your synonyms to it, right? And deliberately, I've also added this thing called pitta, which is written in English. But if you take this notion and apply what would be the normal language ref there, then you can clearly change the language by applying the beautiful SNOMED model to it, right? Or the format to it, because using the language ref set, you can now render it in whichever traditional medicine system and whichever language is appropriate for it. Again, and I think I pointed out earlier, clearly some of this concept modeling that is being done is fully defined. So you could actually apply similar notions to defining these concepts. So you got hierarchies, entities, and concepts covered. So, well, what's stopping us from doing it? So I guess, in some ways we recognize that there's some interesting challenges in this space. The main one that I think we should all walk away from with remembering is what our theoretical entities are very different from the notions that we have in Western medicine. So I gave the example of a kidney system being different from the kidney, and the same way, okay, we then have to think of, if you looked at the SNOMED hierarchy, there's 19 top level concepts, and if we start to ask ourselves, are we actually replicating all or some of those under this theoretical entity hierarchy itself? So are we actually starting to add morphological things in there? Are we actually adding traditional medicine specific procedures in there instead of actually adding them somewhere else, right? Would they then have their own staging and scales? We think this is absolutely fascinating, right? But this is also an area where there's a lot of intellectual work that needs doing. So that's one challenge to address. And of course, it's a lot of space to be covered when most traditional medicine systems seem to deal with herbs. And we think that's an absolute big space for us to go back into. But the balance here is, if the herbs, right, have something that is actually an active, pharmacologically active substance, where would these things go, right? So it's something we think is a challenge, but it's also a very interesting area to look at. Now, people might look at all this and say, "Hey, this looks too crazy. Would anybody ever want to reconcile and crosswalk all the different systems?" We don't know the answer to this. Remember, our notion was, let's first record what is actually being done, so we can then say, does this actually make sense? And can we actually see which one of these is important? So again, just to point out that we're not here to say we know all the answers, but these we think are recognized as challenges. And of course, last but not least, scope, right? So you don't want to start by doing everything, which is why we scoped our, at least our work down to this level. Where are we going with this? Okay, so where we're going with this is, we only spent very little time. This is very early work, but we wanted to share this because we think there's actually something that SNOMED can bring to the space that doesn't exist. There isn't actually a common ontology that we could find that unites all of these. And SNOMED is beautiful in doing this. Certainly description logic, and now that sits behind SNOMED is really, really good at doing that. So we think that it's a plan. The plan is to create a common ontology for traditional medicine and then represent it, as I showed, in SNOMED format, so people can actually start to record this information in electronic health records, right? So what do we think we actually need to do? We don't think we're the experts, so we want to engage with SNOMED International, but also the different NRCs. We know that there are NRCs out there who are actually starting to do this work or interested in doing this work. So shameless plug, I guess, or as I said, if there's people in the audience, or if you know of somebody who is actually working in this space, then we would love to hear from them and collaborate, because we think they'll be so the people doing some of the modeling work or actually having access to the experts. So we're happy to share our thinking and our terminology knowledge in this space. So summary, I guess. Okay. We established that traditional medicine is actually important to align to. We said that are established that SNOMED is actually going to offer something in the space. And more importantly, there's enough commonalities in all different forms of traditional medicine. So all this for us is very interesting. So early work, what you want to say, watch the space. We are certainly aiming to do some more of the work, either push it out as a journal publication, or for all we know, we'll come back next year and say, hey, look what we created, right? So that's really it. Those are our contact details. And as I said, Sarah is in the room. And questions, please.
So thank you, Jay. Jay will now take a very short question. As a reminder, if you're in the room, please use the microphone if you want to ask questions. While you're thinking about that, I do have one from a colleague you'll know. So herbals are definitely a challenging area. However, having them as a focus in order to allow for clinicians to document allergy and adverse reaction to herbals directly or in relation to prescription drugs would be very valuable. More a statement than a question, I guess.
Yes. So I think you can see that this is, as I said, this I think is a really, really interesting area, right? It's not just for practicing physicians, but it's also to pharmaceutical companies as well, because this is probably a multi-billion-dollar industry. But the fact that we're not actually doing this, and the fact that SNOMED might want to do this, is absolutely really, really interesting. It opens up various doors. So thanks, John. I think that's a great suggestion.
Okay, so with the interest of time, with that, we'll conclude this session. So thank you, Jay.
Thank you, guys. Thanks, everybody. Feel free to reach out to us. And, well, Sarah is there in the room, so if you've got questions.
Yeah, if you have questions in the room, please ask Sarah on the front row here. Online delegates, you can join another session through the event lobby. And with that, I'll conclude the session. Thank you.
Thank you. Bye now.